Assalamu alaikum. My name is Dr. Asad Malik, and today our topic is sickle cell anemia. It is a disease and disorder. First of all, there is an introduction of sickle cell anemia. In this type of anemia, there is an abnormal form of hemoglobin called hemoglobin S, which is caused by an inherited genetic defect. It is an abnormal condition of hemoglobin. There is a change in the shape of hemoglobin molecule, and it is a genetic defect. Okay, it is transferred from parents to the offsprings. Okay, come to the pathogenesis. Okay, what are the physical changes that happens during sickle cell anemia disorder? Pathogenesis. Hemoglobin S contains 2 alpha and 2 beta chains, but the 6th position of the glutamic acid in beta chains is replaced by valine. Okay, first of all, there are 2 chains of hemoglobin, 2 alpha chains and 2 beta chains, and on the 6th position, the glutamic acid in beta chains is replaced by valine. Valine molecule is replaced, okay, on glutamic acid. There is a basic change in the molecule of hemoglobin. Previously there is a glutamic acid and then it is replaced by valine. These are the amino acids. It is homozygous condition occurring in high percentage in Negroes, 8 to 9%. In this disease, when hemoglobin is exposed to a low concentration of oxygen, it precipitates into crystal inside the RBCs. Okay, when there is hemoglobin is exposed to low concentration of oxygen, when there is less oxygen concentration, so the hemoglobin molecules precipitates and form the crystals inside the RBCs. These crystals elongate the cell and give it an appearance of a sickle. Then what happens? This crystal elongate the cell. It occurs to cell elongation. Then the appearance of the cell becomes sickle shape. Okay. These are some shapes of sickle cell anemia. It is a normal RBC cell, and they are sickle cell. This is the typical condition of RBCs during sickle cell anemia. This is sickle shape. Okay, now sickle cell disease crisis. This is a viscous cycle which develops in sickle cell anemia. There is decreased oxygen tension in the tissues which increases the sickling. Okay, sickling occurs by the decreased oxygen molecules. So there is a less oxygen molecules, then there is a tension develop in the tissues. This tension causes cell to become a sickle shape. Sickling blocks the capillaries, so blood flow is decreased, increasing hypoxic conditions in tissues. So the capillaries also decreases the blood flow, increasing hypoxic conditions in tissues. There is hypoxic condition tissues. Further sickling occurs and the cycle is repeated again and again. So this condition occurs until the cell becomes dead or becomes unuseful. Sickle cell trait. In sickle cell trait, most of the patients who are carriers of the sickle cell gene but have no symptoms unless they are subjected to anoxia. Under certain circumstances, they may be liable to sickling. Flying at high altitude over 5,000 feet, this condition is called sickle cell trait. Okay, now come to the clinical features. What are the conditions? What are the symptoms? Okay, now discuss this. Number 1, painful swelling of the hands and feet. First of all, there is a swelling, and there is also a pain in the hands and feet. Number 2, chest pain. There is a pain in the chest. It is also a condition. Number 3, easy fatigue and intolerance to exercise due to reduced hemoglobin. When there is a less hemoglobin, you get easily fatigued during exercise, and you are intolerable to the exercise. Okay, and you have also a difficulty in respiration. Number 4, pallor, icterus, and splenomegaly. Okay, number 5 also splenomegaly. Splenomegaly is a condition in which spleen becomes enlarged. Okay, there is a spleen organ, so it becomes enlarged during sickle cell anemia. It is also a symptom. Hematuria. Hematuria is a condition in which there is a blood in urine. Okay, it is also a severe symptom. Number 7, development of immunity for Plasmodium falciparum. So there is a immunity developed against the Plasmodium falciparum. It also, these all are the clinical features to the sickle cell anemia. Now come to the diagnosis. How we diagnose the sickle cell anemia in the patients. Sickling of normoblasts due to low oxygen tension. When there is a normoblast becomes sickled due to low oxygen tension, it is diagnosed. Hemoglobin is less than 8 gram percent. So hemoglobin is less than 8 gram percent. Presence of hemoglobin S is demonstrated by the examination of RBCs. So normally they will examine the RBCs and hemoglobin tests. So when they are less in concentration, in contrast with the normal range, so there will be diagnosis of sickle cell anemia. Now come to the treatment. How they treat the sickle cell anemia, and how can we treat? Sickle cell anemia is treated with folic acid, and the infection is treated with antibiotics. When there is an infection during the sickle cell anemia disorder, so it is treated with the proper antibiotics, which help in curing. And when in sickle cell anemia, the treatment will be occurred by the folic acid. So folic acid help in the production of RBCs and hemoglobin, so it will empower the cells to fight with the sickle cell anemia. Blood transfusion is advised when hemoglobin is falls to 5 gram percent. When there is a very less amount of hemoglobin, when hemoglobin concentration becomes very low, so blood transfusion is the only way to cure the sickle cell anemia. Okay, that's all from sickle cell anemia.